H1N1 cases are on the rise across Delhi-NCR, but the ICMR has said there is no new H1N1 strain and there is no need to panic. The ICMR says the strain currently circulating is a known H1N1 lineage. What seems to be the usual symptoms: fever, cough, headache, body ache. Most people recover with rest and appropriate care, but the numbers are still a concern. A local circles survey found 54% of Delhi-NCR households reported at least one person with flu or viral fever-like symptoms. 39% of households, 2 or more people were reportedly sick at the same time. The H1 cases have been almost around 1,700. How should one really put all of this in context? I'm being joined by Dr Ishwar Gilada, who's a consultant in infectious diseases and HIV. Thank you very much, Doctor, for joining us. My first question to you, Doctor, worry, no worry, caution. What should one do if you get a cold? How do you differentiate between flu, H1N1, or do you not need to differentiate between the two?
Thank you very much, Sneha, for having me on the show. Basically, there is no sure shot way of differentiating based on the symptoms. The symptoms are similar, whether it is a COVID-19 or H1N1 or RSV or different type of flu. Hello.
Go ahead, doctor. We can hear you loud and clear. Go ahead.
So basically, unless until you do a particular test for H1N1, and that unfortunately is very expensive. It's a PCR test. Unlike COVID, we tried to bring down the cost initially by fighting in the Supreme Court, then bringing down the cost from 2,500, 5,000 rupees, 4,000 to 250 rupees, 300 rupees. But now H1N1 cost is so high, it is costing around 5,000 rupees. How many people can afford that? And therefore, it is empirical diagnosis based on what season is going on. Currently,
yes, doctor. Go ahead, doctor. Go ahead.
So currently, because there is a season of H1N1, we consider that whatever people are coming, they are H1N1. However, it's easy to first rule out whether it is a COVID or not. And COVID test is still cheap, COVID antigen. So when the patient comes with the similar symptoms of fever, cough, sore throat, running nose, body ache, then you do COVID-19 test. If it is negative, presume it is H1N1. Now, there are two things. One is the test is expensive.
I see.
Two, if the vaccine is there, because vaccine could have prevented at least 40 to 50%, 60% of H1N1. But again, vaccine is expensive. So nobody has worked on these two counts in the country, whether to bring down the cost of vaccine, which makes affordable, and secondly, bring down the cost of testing, which becomes affordable. Both the things are yet out of common people reach.
So, Dr. Gilada, what should one do? You know, if you've got a cold, if you've got fever, what should one do? How should one's response be?
So basically, you make two categories. One is those people which are healthy, young people, don't do anything. Just give them some antihistamine or some kind of decongestant and paracetamol. But those which are in high age, the pregnant women, or those which are with some kind of comorbidities, diabetes, obesity, or cancer patient, on chemotherapy, renal patient, then you think that yes, H1N1 can harm them by becoming having a pneumonia, ending up in hospital. That will be fatal. That can be fatal. So in such cases, if the patient report to you in 48 hours, start oseltamivir, which is antiviral, and it works on H1N1.
All right. With the kind of cases that are there, and obviously local surveys, this numbers that have come out is much smaller in number. They've done some 32,000 households. But the numbers from that, even if you take it as a sample, is quite staggering. I'm sure you have a sense of what's happening across Delhi-NCR. What should one do? There's this advisory which has come out in some way saying wear your mask, avoid crowded places. Doesn't really happen, Doc.
Delhi being a capital of the country, it gets more attention. Same thing is happening in Mumbai, Pune, Bangalore, and almost everywhere in the country. Secondly, the numbers which come, they come out of testing done. And test is very expensive, therefore very few tests are done. So real numbers are in thousands. It is not in hundreds, everywhere. Secondly, what should people do? Start using mask. We have been taught how the mask use is there. Secondly, all your personal hygiene precaution. And thirdly, protect those people which can be at higher risk. Because the incubation period for H1N1 is very small. It's just 2 to 3 days. Unlike in COVID, it was a couple of days, sometimes more than a week. So if somebody gets, young person gets from somewhere, protect your elderly people who are at home or those which are with comorbidities, because they are at more risk of getting H1N1 and more risk of getting into complications.
Now, Dr. Gilada, is this seasonal? Is this only seasonal? I mean, is there a shelf life for this? When I ask that, after this season, does it just go off? Do we need to be wary about it? Because COVID-19 stayed on.
Sneha, there are two things. One is a short answer. Yes, the season will go away and we can have a sigh of relief. But the long answer is we are getting most of the zoonotic diseases. The infections come from animal, birds to human beings. And because of the human-animal interaction, bird interaction, we are bound to get more and more zoonotic infections. In last 40 years, most of the infection, almost 70% of them are zoonotic diseases. So we need to look after ecology, we need to look after global warming, we need to look after human interface with animals and birds.
Doctor, are states, is India prepared for this? Is it well equipped? Because I don't know, there have been, high level meetings that have been happening, looking at hospitals, looking at, how much of the preparedness is there. How do you look at this?
See, I will look at it that yes, it is very high. And as you compare to last year or previous years, it is multiple numbers. So it's not just higher like 40-50%, maybe 4 times more, 5 times more. So wherever we are getting such cases, they are turning out to be H1N1 if we do the test. And sometimes you do 4 tests, you find 3 positive, we consider that everybody coming with similar symptom could be H1N1. So how we should look at it, if the person comes to you within 48 hours, Oseltamivir will cost only 400-500 rupees for the entire course of 5 days treatment, which is cheaper than doing test and cheaper than waiting and thinking that person will recover. So if there is a possibility of treating, please treat within 48 hours. It will work well.
That's an important information, and obviously, because you've said it, it's also important they go to the doctor and they get the prescription for what it is required. Dr. Ishwar Gilada, when we look at the national capital, what would you tell to people, not just national capital, across the country, there are cases that are being reported. What would you tell people, particularly in the vulnerable groups? Schools are happening, children will go to school, small children will go to school, elderly are going out. How should they look at this phase?
See, there are 2 ways. One is those which are at risk of getting infection from somewhere and infecting vulnerable group, asking them to use mask. They are not going to listen to you. Then you have to ask those people which are at risk of getting infection and getting complication, they should wear the mask. So those people which are elderly, pregnant women, which are with some kind of multiple comorbidities, they must use masks so that they do not catch infection either when they go out or if their near and dear one are going out and infecting them.
It's also the festive season, Dr. Gilada. It's the festive season that we are entering. Raksha Bandhan is just around the corner. There are other festivities across the country. Onam down south, Pongal, all of these are festive seasons, huge crowds, huge gatherings, times of joy. How would you tell to steer through this?
See, just like it is a festive season.
Are you going to be part of festivities?
Yeah, I'm going to be part of festivities. It's just like for human being, it's a festive season. Even for viruses, this is a festive season. So festivity is not only for you, it is for organisms, it is for viruses, it is for any infections which are likely to come. So therefore, we should always predict that something such can happen, particularly in the season which is the rainy season.
So what do you tell? I mean, for those who are attending the weddings, who are attending Onams, are you saying then go there if you have to, but wear your mask if you're from the vulnerable group?
See, be careful than being sorry. If you are really in a vulnerable category, you must use mask. There's nothing wrong in using mask. So basically, by and large, we think that using mask is some kind of stigma. It is not a stigma. It's a precaution.
Right. And especially after COVID-19, I think India and the world has gone really sensitive to the use of masks, and it's well appreciated as well. Dr. Gilada, is India better handling communicable diseases and, if I can use the word outbreaks, I don't know whether you would agree with the word outbreaks such as this?
I can appreciate that it is being handled much better than it was before COVID-19. And India has not only shown its way to India, but to the rest of the world. So I'm only worried about why India or Indian government or any pharma companies from India, they did not work on making this H1N1 test cheap and easily available, and particularly vaccine to be affordable. So if those 2 things are looked after well, then it is not only for India, it will be for the rest of the world.
Thank you, Dr. Gilada. Thank you so much for your time.